So, to start off, I would say that for my portion, I'm going to argue that Black communities have been prematurely crippled by institutions of environmental racism and strategic systematic oppression and self estrangement. Um, to begin, I'm using a quote from Ras Hassan's Heal Life Hustle, and he says, "It's always good to learn more about yourself, and having the ability to tune into yourself creates greater balance internally. Ancient Egyptians wrote on the outside of their temples, 'Man, know thyself, and thou shalt know God in the universe.' The journey of healing is one of self discovery, and in that process, if you are open, you will learn more about the divine universal principles along the way. Change your mind, change your body, change your body, change your mind." Now, since we're focusing on Black mental health, I thought that quote would be a fantastic place to start because I will agree that that is probably the goal that we're trying to get to. I think that everyone is trying to get to a place where they can understand themselves and, knowing your body, knowing your mind, they all go in one. You can't have a healthy mind and an unhealthy body. You can't have an unhealthy mind and a healthy body. It just really won't work well. Um, I think, however, though, Black communities have not been given the opportunity and the resources to have that healing process start. Many Black communities don't even know where that starts. And I don't want to make a generalized type of assumption based on that because I'm not going to say that's all Black communities. I won't even say that that's, you know, Black communities just in rural areas or cities. I think it really is widespread throughout the entire country. But I think we also need to give ourselves some grace and with the fact that we have not moved as fast as other communities simply because we don't have the resources to. Not only that, we don't know where to find the resources. There was a quote by Dr. Joy DeGroy in her book, Post Traumatic Slave Syndrome, where she states, "Understanding the role our past plays in our present attitudes, outlooks, mindsets, and circumstances is important if we are to free ourselves of the spiritual, mental, emotional, and physical shackles that bind us today. Shackles that without them, like we would not be able to live properly. Well, with them, we cannot live properly, I should say." And I thought that would be great to tie into this because it kind of goes along with what Ras Hassan says. Our mental, like if we don't understand ourselves emotionally and mentally, we're not going to be able to, as a community, move forward in a healthy way. I think she really grasped like what I'm trying to say into professional words, just because sometimes you know what you're trying to get through to people, but you just don't know how to say it academically. And I think she did just that. Um, I think this is the part that ties into the strategic self estrangement. We don't do it to ourselves on purpose, but it's something that we've taught as an effect of racial discrimination, Jim Crow era, slavery, post slavery era. Um, this is all stuff that has prevailed for generations in the Black community. And people like to write it off as, oh, that's just where they come from, or that's just how they are, but it's not how we are. This is what we were made to be. This is what we were taught to be strategically. And, you know, Dr. DeGroy calls it post-traumatic slave syndrome. In a way, it's like PTSD. And that one is post-traumatic slave disorder, but I mean, it's post-traumatic stress disorder. But this one is post-traumatic slave disorder, meaning that Black communities are impacted by the effects of slavery. And not a lot of professional and medical institutions like to admit that fact. And I think it's really overlooked and what creates us, like it creates our mental environment. It creates who we are as a people because we're still trying to recover from that. Um, and we often hear the assumption that, oh, that was years ago, it was so long ago. But if anyone knows anything about genetics, we know that pain and trauma is genetic. It gets passed down through the body. If the body is passing this down, the mental cannot survive, the mental cannot recover. Oftentimes we have certain types of actions and behaviors, we don't even know where we got it from. We just know my mom did it, my grandmother did it. Oh, this is how we grew up in our house. This is just what happens. but we don't know where it comes from. And it comes from that trauma that our body has kept inside. And something that I would also like to add, along with the environmental racism portion, from A Terrible Thing to Waste by Harriet Washington. On page 82, she says, poverty-trapped Black and Hispanic families live in lead-poisoned homes. Limited educational and career opportunities drive this poverty, and slums are the products of this racial segregation. So this ties back into what I just previously said. You know, there's certain mental parts that ties to the body, but there's also parts that tie into the physical, where we're at environmentally. And in this book, she talks about how there's various reasons that Black communities also cannot like succeed in the ways that they want to, which is because of environmental racism. If you look into rural cities, you understand the process of redlining. Redlining basically was used by governments to say, this is where the Black people are living, this is where the Hispanic people are living, this is where every race is living who is not white and is of a poor background, basically. And strategically, they've always used these places for lead poisoned homes, dumping trash, building highways, breaking down communities. And it's been strategic for them, and it's worked successfully for them because, again, we've been held back. We've been held back physically, which has held us back mentally. You know, I'm trying to think of it. I don't really think it's a quote, but I think it's something we often hear a lot, which is, you're a product of where you come from. Where you come from does significantly impact, you know, who you are. But you also have to take that initiative to not make that the entirety of who you are. Mm-hmm. You have to grow from that. You have to come up from that. But if you don't know there's resources out there to help you get out of that situation, you're not going to. You're going to stay there. You're going to marry there. You're going to have children there. And when you're not aware of the issues that are in that specific place, if you're not aware of the poison in the water, if you're not aware of the intentional economic disparities, you're not going to know to get out. You're not going to be able to save yourself, your family, your children, and generations down. There's another quote I wanted to use from A Terrible Thing to Waste, which says, descriptions of the vulnerable that focus on economics and exclude race are semantic shrouds that are not only euphemistic but inaccurate. Poverty is certainly a risk factor for environmental exposure, but race is a larger and more consistent one. What I believe she meant by saying this is, too often we use the word poverty-stricken when the reality of it is this is a factor of race. It's not a factor of poverty, because Black communities who are in poverty are not as negatively affected by things as white communities are. We know that for a fact. They can't say that professionally, so they use the word poverty. They make it a huge one size fits all so that Black people get overlooked. Black people continue to be left behind, and Black people are continuously ignored basically by the ones who they're calling out to for help. And this is the part that ties into the environmental racism that I was talking about. In another quote from Dr. Joy DeGroy, she says that you cannot expect people to recover from trauma while trauma is still accurately occurring. And she really ties into what I'm trying to grasp here, which is that, you know, you have to recover from slavery. You have to recover from Jim Crow. You have to recover from neo-slavery, which actually was the time in between emancipation and Jim Crow. And during this time, which is what we rarely learn about, there was a system called convict leasing. And convict leasing basically allowed it for the American government to create any person who was convicted a felon, basically a slave. And it's something we don't often hear about because I think it was, honestly, in some cases you could say it was worse than slavery because, you know, convicts, even today, are seen as the worst people of society. They're not protected. They're not seen as human. Their rights are completely stripped away. Whereas under slavery, you could say that this Black person is property, it's an investment, it's capital. Under convict leasing, you don't have to be taken care of. People don't have to seem as if they don't want you to survive. Under slavery, they somewhat wanted you to survive so you could have healthy children so they could work as well. And basically, because of this, there's a lot of impact in the Black community where we still don't understand how pervasive these policies and strategies are where we live. They prevent us from having access to things we should have access to. They cripple us from knowing that these resources are even out there. They don't accurately teach our children in our public schools about the history and what has happened to us systematically. And all of this, I believe, ties into the Black mental health crisis that we have today. A lot of this stuff is unknown, it's untalked, it's not talked about, and people are simply unaware of it. I believe that if we focus more on our history, on the history that we are being taught, the history that we are passing down to our children, and the environmental racism that we are unaware of, this will this will contribute so monumentally to the Black mental health as a whole. I believe that Black communities will be able to develop quicker. They're going to be able to move on from their trauma faster. And it will give us the opportunity to say, what we're okay with and what we're not okay with. They give us the ability to come together as communities and say, okay, we're not going to allow them to keep bulldozing our communities. We're not going to allow them to keep poisoning our waters. We're not going to allow them to keep building us houses that are filled with lead that is strategically keeping us back. Um, that's basically all I have to say.
Um, so as far as our conversation on Black mental health, mental wellness, I took a more a deeper look into the conversations that's being had in the spaces um that are supposed to be like facilitating what being healthy is. And so a main part of my discussion was just looking into how can I word this? How clinicians, mental health clinicians, for one, the representation, that's a big thing because you can't, if you're in these rooms making the decisions, right? There needs to be some type of representation for everybody, and that includes minorities. Um, and so one quote that kind of hit this right on the head was A Terrible Thing to Raise, page 71, where the author mentioned, and I quote, a level of discomfort in acknowledging America's racial disparities. So I feel like if there aren't conversations being had that acknowledges that there are racial disparities, right, then that creates space for those racial disparities to grow. So one, we need to hold our physicians and clinicians accountable for that and saying, hey, what are you doing when you're having these meetings? Are you going into these spaces? What are you doing, or what does the conversation look like as far as how are you making room for Black people or any minority to one, feel comfortable in this space, to be able to come into a doctor's office or whatever and say, hey, this is what's going on with me, and not feel like they're being overlooked or that their symptoms are being overlooked. Because there's often too many times where we'll go to the doctor and say, hey, I'm experiencing this, this, and this. And then it just either goes unlooked, overlooked, or the um the clinician will be like, as if be like the person doesn't understand their own body, if that makes sense. So kind of going back to what you were saying about how the mind and the body, there's some cohesion there, like one can't be complete without the other. Um, I fully agree with that because it's like there's this, okay, so um in Heal That Hustle, there's another quote directly after the quote that you said that says the body and mind are of the same system and have a symbiotic relationship. And so I took this quote and I kind of like I applied it to what I had already been thinking and it kind of hit it right on the head. But like you were saying, there's a person knows their own body, right? And so when a black person goes to the doctor and they say, "Hey, this is what's happening to me," or "I'm having these thoughts or these cognitive processing," since we're talking about mental health, um, I feel like there should be more inclusivity of how a physician will handle that information instead of just saying, for example, I had a friend who went to the doctor and she was explaining some things, and the doctor like approached it as if she wasn't being truthful about what she was experiencing. And I just thought that was crazy to me because it's like you can, yes, you are educated in medicine and mental health and everything. Okay, cool. But you cannot sit here and tell this person that they what they're experiencing is not real because at the end of the day, it is a reality for them. And so I think, one, if we're having conversations that include the way Black people are treated in these facilities, as opposed to other races, then I think that's where the gap within racial disparities can become a little less big of a gap, right? And eventually over time that'll eliminate that gap as far as the treatment. There was also another point I had talking directly about um sorry, another source I had talking directly about someone's experiences um about being diagnosed and how there are often a lot of misdiagnoses or things that go undiagnosed within the Black community. This article by Stephanie Robertson on the at the National Alliance of Mental Health. She said, "For years, I struggled with undiagnosed ADHD, misdiagnosed with other conditions while searching for answers. My story is not unique, and that is precisely the problem. Black and African ancestry voices are still not adequately represented in mental health research, leaving too many unheard, unsupported, and untreated." So I think this definitely goes back to the representation within these spaces. And while there is a significant increase of representation, I think you have to also acknowledge the fact that in these areas, in these facilities where health is supposed to be the number one concern, there are still physicians who don't have that on the forefront of their mind when assessing a client or a patient. There's this there's this superiority, if that makes sense. So, and like I go back to Black people being knowledgeable about their own bodies because we are. And so when you go to the doctor, it's kind of like, okay, I might not know what the issue is, but I know that there's something going on. So I need you to hear me, and actually listen to what I'm saying instead of saying, okay, well, I'm the doctor, I know exactly, or this superiority that there is. So I think there needs to be more understanding in that sense. Um, and so, yeah, the author of this also says that she knew something wasn't right, but without research, representation, or a roadmap, healthcare professionals, family members, and her remain in the dark as to what was going on. So there wasn't much, I'll say, effective communication as far as like what the diagnosis was or what it could have been. And she was given like the wrong diagnoses instead of there being a thorough look into what exactly was happening. And so a lot of the times that's the reality for Black people when they want to go and see if there's anything going on. Um and I know I'm kind of broadening it as far as mental health and health in general, but I think what applies for health in general for Black people also applies to mental health, especially since it's something that's not as talked about in our community. So I feel like there's, as far as what we can do to help the issue, I think there should be more intentionality from physicians and facilities that are supposed to um intentionally care for us. But also there needs to be some how can I say it? Accountability. Like as patients or as people that directly um benefit or don't in a lot of cases from the medical from the healthcare system, I think we should hold our doctors and um therapists or whatever to a standard in which it's like, okay, I have this expectation of you. I need you to meet this expectation because in this position you are supposed to. Like this is what you are supposed to do. So yeah, that was my spiel on that.
I agree with like what both of you were saying, pretty much. My thesis was really that in this presentation, I will argue that historical inequality and racism has impacted the relationship Black people have with mental health. I say this because we're often underdiagnosed and undertreated in comparison to our white counterparts. This presentation will discuss how post-traumatic slave syndrome, racial trauma, stigma, and gaps in care contribute to disparities in mental health treatment. To kind of like piggyback off of what you were saying, Demaria, I feel like it's a very complex issue. And I feel like through our discussion, we can see how being Black, particularly in America, comes with this weight from past racial trauma, current racial trauma, just like, our lived experience in general, and how that not only impacts our physical health, but our mental health, and how we see that, like what you were saying, Jade, about environmental racism, how this impacts mental health as well. But first, I just wanted to touch on what like post-traumatic slave syndrome is and how like the legacy of slavery has impacted us today. Um, the underutilization of mental health resources by Black Americans is not a reflection of disinterest, but rather the consequence of deeply rooted historical, cultural, and structural trauma. Post-traumatic slave syndrome, or PTSS, as theorized by Dr. Joy DeGruy, describes the multi-generational trauma resulting from centuries of slavery, followed by continued systemic racism and oppression. This syndrome manifests in internalized racism, mistrust, adaptive behaviors that can inhibit help seeking and emotional vulnerability. I feel just like in general, the Black community, we're always in this survival mode, and it manifests in us, particularly considering our physical health, I feel like overall more than our mental health. And with that, we see like this stigma that is very apparent in the community, where it's like mental health is kind of, to a lot of people, I wouldn't say fake, but it's just not validated as much as like, physical concerns, because we're very aware of like our disparities and higher like rates of like hypertension, diabetes, and whatnot, and like how that impacts the community. But when it comes to mental health, I feel like we don't talk about the disparities as much, and like what Damari was saying about how we're undertreated and underdiagnosed, and like the like sorry, what is it called? The snippet she read about like the woman who was misdiagnosed. I feel like that plays a part in it. But I also think that the sociological theory of weathering can be applied here. This basically states that the effects of racism over the life course have been shown to weather the body, demonstrating that there is a complex interaction between social experience and physical health. The intersection of racism, gender discrimination, and social and economic inequality places Black women particularly at the center of multiple stressors. So not only are we dealing with like racial discrimination, gender discrimination, economic inequality. I feel like all of these things compounded just makes our mental worse off. But I feel like there's this disconnect. Like we know we're dealing with all of this, um, like I guess just we're dealing with a lot of stressors, but that's not reflected in the way we're treated. And I feel like that has a lot to do as well with like representation in the mental wellness field. I feel like for us, I feel like for me personally, being at HBCU, I feel like it's nice that our mental wellness resources, we have pretty much all Black practitioners and whatnot, especially because I don't know about anybody else, but for me, like being in college has really like made me focus more on my mental health. And being like someone who's seeking out that help for the first time, it was extremely comforting knowing that I had a Black woman who was going to be listening to me, who understood not only the struggles I had as a college student, um, as just a young woman developing and like trying to find my way in the world, but also being a Black woman, because I feel like we are very intersectional. We're dealing with a lot of like unique discrimination that it's hard for, I wouldn't say impossible, but it's hard for like non-Black women to like understand. I feel like there's also like the context of like being someone who's Black, you understand like cultural things that might be missed or go unlooked. Um, but like more onto like the historical context of like our disparities in mental health. I feel like when we're talking about like the exploitation and experimentation that took place, that we read about in medical apartheid, highlights how medical distress can also like lead to why Black people aren't as likely to seek out mental wellness resources, particularly like this Tuskegee study and how this showed how exploitative the healthcare institution is. In a University of Michigan public health article, the author wrote a long history of the healthcare system doing harm to the Black body and mind. So there's this history, right, of like the institutions who are supposed to be there to help us, heal us, harming us. And I feel like that leads to why we're just under treated and whatnot. In a research article, this was actually like outlined in quantitative numbers. It's called African American Men and Women's Attitude Toward Mental Illness, Perceptions of Stigma, and Preferred Coping Behaviors. And the authors wrote, in a recent large-scale national survey, a lifetime prevalence rate of 10.4% was reported for African Americans, thus indicating that this group is affected by depression at high rates. Results also showed African American women, 13.1%, have a higher prevalence of depression compared to African American men at 7%, which is consistent with literature indicating women have higher prevalence of depression compared to men. But overall, the study found that participants were not very open to acknowledging psychological problems. They were very concerned about the stigma associated with mental illness, but were somewhat open to seeking mental health services. They also found that religious coping appeared to be the most preferred coping mechanism, and it was significant. Perceived economic class effect on religion was found. But just to like end off talking about like cultural stigma, I feel like this is also one of the biggest factors in why mental health and wellness isn't, we aren't receiving resources as much as we should be. I know I've heard colloquialisms from like older relatives and whatnot, particularly like, like with depression, like they'll say like, go depress those dishes, like just stuff like that, like, kind of downplaying depression, anxiety, and mental health, and just like um, finding other reasoning for why you're struggling, and just like this kind of like comparison of like, you know, like physical things being more important than like mental health and wellness. But yeah, overall, I just feel like cultural stigma, post-traumatic slave syndrome, and like other racial trauma has like particularly hindered our ability to receive appropriate mental health care and resources. And like by addressing these barriers, we will need to rebuild trust in the healthcare system, particularly through like culturally competent care, trauma-informed care, and then also like having more representation in practitioners and just, reducing the stigma.
Okay, so hello everyone. I'll be focusing on like what hits close to home, which is mental wellness in Black communities in New Orleans specifically. I agree with what everyone has to say so far, and I just feel like it's unfortunate that the Black community has to have like the highest rates in mental health issues compared to other races. So my thesis is, in this presentation, I will argue that mental wellness in Black communities, particularly in New Orleans, is severely impacted by systemic racism, historical trauma, and a lack of cultural competent care. I say this because these structural barriers not only prevent access to quality treatment, but also contribute to generational cycles of untreated mental health issues and community mistrust toward the healthcare system. This presentation will discuss the root causes of these disparities and explore Afrocentric counseling as a healing alternative, evaluate current local policies like the proposed mental health wing at the Orleans Parish Jail, and propose action steps that align with the mission of the New Orleans Mental Health Collaborative, which was my organization. So let's start with the reality, which is that Black people in New Orleans are disproportionately exposed to poverty, housing instability, violence, and discrimination. These stressors are linked to serious mental health issues, but even when the need is clear, access to care is often out of reach. Black communities are less likely to receive treatment, and when they do, it's often through emergency systems like the police or jail, not through long-term supportive care. So to better understand this, I drew from the peer review article, Complex Racial Trauma, Evidence Theory, Assessment, and Treatment by Dr. Monica T. Wills and colleagues. The authors explain that racial trauma isn't just a response to isolated events, it's the result of ongoing compounding exposures to racism, discrimination, and exclusion. This means that for many Black people, trauma is layered and chronic, and our mental health systems are not built to respond to that kind of long-term harm. So here in New Orleans, we've seen how disasters like Hurricane Katrina created by long-lasting trauma, especially in predominantly Black neighborhoods that were already neglected. So people are still going through the stuff that happened in Hurricane Katrina now. That still affects their mental health because for one, they were promised money that they never even received. Like their homes were destroyed, people died. So it was very traumatic for them. And today, the mental health system still lacks trust, so the care available often isn't culturally informed, and there's a major shortage of Black therapists who understand our experiences. So even when someone wants help, they might not feel like it's safe to ask for it, unfortunately. So this is why we need approaches to care that are built in around like the live experiences of Black people, not just copy from one size fits all model. So to offer one alternative, I looked at the trauma and mental health social work with the urban populations by Will Wibben and Wilbin. And this book outlines the Afrocentric counseling, a model that centers Black identity, spiritually, and cultural resilience. So one quote that really stuck out to me was that the Afrocentric counseling provides a holistic framework that embraces spiritually, community, and cultural identity as essential elements of healing. So this kind of care doesn't just ask like what's wrong with you, it asks like what happened to you and how can we heal in a way that honors who you are. It brings culture and community into like the therapy space instead of like just leaving them out. So shifting to what's happening right here in the city, the proposed 100 million mental health wing inside the New Orleans Parish Jail, which was the article that we read in class. So She explains that the project has sparked major backlash, especially from formerly incarcerated people. One quote from her article reads that formerly incarcerated individuals say that this plan sent the wrong message, that people with mental illness belongs in cages, not clinics. So this is a perfect example how systems often criminalize mental illness in Black communities. Instead of investing in community clinics, cultural competent providers, or prevention programs, we're building treatments inside jail. That's not justice and it's not healing, clearly. So that's why I chose to highlight the New Orleans Mental Health Collaborative because it's doing more than working with like connecting families and schools and nonprofits and mental health providers. And they're doing this to create like a stronger and more equitable system of care in New Orleans. So their vision focuses on prevention, equity, and system level change. And it's about making sure that mental health can actually reach our community and reflect who we are.
I just wanted to go through and read our thesis just to make sure that we have that like taken care of, if y'all wanted to. So mine was that in this discussion, um, I argue that the field of mental health has not been inclusive of minority groups. And I say this because many Black people have been undiagnosed or gone misdiagnosed regarding their health and specifically in this case their mental wellness. And so this discussion emphasizes the racial disparities in our society, as well as the idea that Black people aren't knowledgeable of our own bodies. And so yeah, in my portion of the discussion, I just targeted those different things. Yeah.
Along with what Demaria said earlier about how mental health professionals don't usually give us our voice and our autonomy of knowing what we already know for ourselves, I think that this contributes in a way to our spirituality and the religions that we had before we were taken and put into slavery. I think that a lot of Western religions give us a certain type of guilt and a certain type of anxiety about living our daily lives. And I think this can contribute to the mental health disparities that we have now. Um, so I just saw that there might have been a link there in the fact that, like, you know, we're silenced in so many parts of our life. We're silenced physically, we're silenced mentally, we're silenced spirituality, you know. So that's what I wanted to say.
I think it's interesting you say that because one of the points that I wanted to get out, when I was initially talking was about the Western like centric norms and values that there are in society and also in some aspects in spirituality as well. But I feel like me being a psych major and going through like the different approaches and the different psychotherapies, a lot of them was founded on or with Western centric values and norms at the center of it. And so that makes the different approaches, some of them, not as applicable to different cultures. And it's not like they wouldn't be ideal to Black people or to really any marginalized group. So I think that also plays a role into the mental health aspect of like, okay, if a person needs to be assessed for whatever reason, right? They come and then they realize that, or not even realize, because sometimes a lot of times it's not realized, right? But a physician will use these approaches to examine a client or assess a client, but it's like the norms and the foundations of some of these approaches don't really align with actually helping the client. Um, so yeah, like when you said the Western centric values of that, I think that definitely plays a big role in mental health as well. It's like a person can't be like adequately um
It's like they make themselves the default when that.
right. So yeah. Yeah.
Um, I also agreed with what Jordan was saying because we did use a lot of quotes from the same book from post traumatic slave syndrome. I agreed with her in the case that, you know, there are times where we've been exploited in the medical industry. So we haven't been as trusting of that same medical industry to take care of us mentally. If they don't take care of us physically, they're not going to take care of us mentally. In the sense that for hers, it really was about the health, but that for me, it was about the environmental factors and how they contribute to that health. So I just thought that was significant.
Mm.
Something Morgan said that stuck out to me was when she was talking about how Black people are criminalized heavily for mental illness. And I feel like that kind of plays into mass incarceration and how the system is just so quick to put us behind bars and throw away the key. And I feel that while there needs to be more attention to like, reducing the stigma and us as a community um fostering like ideas and an environment that like makes people not feel bad for seeking out mental resources. Like I feel like while there is like some what is the word? Accountability that we need to have. I feel like there's a lot of accountability that these institutions need to have in the way that they treat Black individuals. Never mind, like, the way they treat our physical health. I feel like they also treat our mental health just as bad in a sense. But yeah.
Yeah, just going back into that because from like a personal standpoint, I had a family member that went through something similar where she was incarcerated, and mind you, she never had any criminal background. It was a domestic violence case, but they couldn't necessarily prove that she was going through that. So she defended herself, and unfortunately she became, she was behind bars. But it was crazy, like being in a courtroom and how they were speaking, like they was like basically making it seem like she was a monster or something. And it's really because I feel like it's just the color of her skin. Like if it was like a white woman, then I'm pretty sure this wouldn't have even been the case. So it's just crazy that the things that, the Black community has to go through as far as being incarcerated. So yeah.
This actually ties exactly back into what I was saying about convict leasing. What Jordan and what Morgan said is this is reminiscent of what we went through with convict leasing. Convict leasing really happened post slavery. It was that in between stage of emancipation and Jim Crow, when they didn't know what to do with all these newly freed Black people and they had nobody working. And they created convict leasing essentially to say, we get you for one felony, we get you for one crime, you're done for the rest of your life. You're a ward of the state, and now the state owns you. Mm-hmm. And a lot of the times they would arrest us for stupid stuff, standing on the sidewalk without working, cussing in public, drinking, a Black man looking at a white woman for too long. They would use these types of crimes to literally put us behind bars for the rest of our lives or give us a fine that we could not pay. Now, a lot of the times, the fine may have been $1, $2, $3, $4, $5. But when you think of it, newly freed people didn't have any money. They weren't paid from slavery. They had no means of making $2 to $3. They may have made that maybe in a week. But you got to remember, like, they're getting paid cents per day. It oftentimes it didn't amount to $2, $3. They also have to take care of themselves. They have to take care of their children. So they couldn't pay these fines. So they became property of the state, property of the government. Now, although this was outlawed by Theodore Roosevelt, I believe, you still see it today. You still see people getting arrested for completely like flagrant reasons, or it's like, this is the victim. Why would you be arresting the victim? You see that they need help. But because it's more strategic and it just helps, I guess, the new Jim Crow prison era, they're going to slap that wrist on, like they're going to slap the cuff on your wrist simply because of your skin color, simply because they want you to get that felony under your belt, because as long as they can put that under your belt, they can take away your rights. They can take away your ability to vote. They can take away your availability to get a job even when you get out of jail. It's all reminiscent. So
It's almost as like, well, it's not almost, it is. Like if it's not one system, it's another. Like Black people will
Exactly.
never be free as far as like that's what it seems
They
like.
just want to make a new one. They're just gonna give it a new name. They're gonna
Right.
make a
So
new one
it's
and give it a
like
new name.
it almost and I feel like that's where this isn't really on the mental health topic, but that's where this sense of like I feel like motivation and like discouragement is really high um because of the fact that it's kind of like it's always something.
Mhm.
So it's so discouraging like like collectively as a people within the Black community. It's kind of like are we ever really gonna see change in that aspect? So yeah, I think it's a really interesting conversation to have. Yeah, it's a lot to think about. So, but yeah, I think
But yeah, like even not just how you said it, that can contribute to mental health.
mm,
That feeling
Exactly.
is always something, that stress, that it's not one thing, it's another. Or, that Black saying we always say, like, I'm sick and tired of being sick and tired. That's a stressor on your mental. Like
Mhm.
that's going to contribute, even if you can't say what specifically it is because it's too much stuff. That's going to
yeah.
contribute to your mental health. It's going to bring you down negatively.
Mm,
I feel
You
like,
guys gonna get? Oh, go ahead.
sorry, like this conversation we guys are talking about, it makes me think like it's really hard to get oppressed people to like realize that what they're going through is like, I don't know how to put it into words, but like I feel like sometimes we get used to our oppression and like the way this country treats us and it's been treating us that we're just kind of numb to it.
mm,
Mhm.
And we don't take that into account when it comes to like mental health and mental wellness. Like, you know, like you were saying, like we're just used to it. We're used to these systems of power, exploiting us, treating us like our lives don't matter, that it's like we're dealing with all of this like mental like strife and like stressors and whatnot, but like I don't know. I feel like it's just we don't take that into account, like,
mm.
like why look when we're being diagnosed for certain things, like when we're dealing with like depression and whatnot. Like I feel like this is not something that's talked about with like diagnoses and like using like the trauma that we endure. I feel like it's more than valid of like, you know, a reason why we deal with like so much stress and whatnot.
Yeah, I completely agree. I think the mental frameworks after like just years and years and so much stuff, I think the mental frameworks of a lot of Black people have just become like kind of it's become the norm
Mhm.
Like
to be
desensitized.
right.
Exactly. Mhm.
Yeah, decent, yeah. And so especially with like a lot of older Black people, not all, but a lot, like after going through so much, it's kind of like you can see the oppression kind of manifesting from the Black community because we've been exposed to it for so long.
Yeah.
Exactly.
So yeah, just like even if it's like the small things to say we say to each other or the way we think about mental health in like at all. It definitely shows, and I think like for anybody or anything after being exposed to something for so long, it's kind of like you take on these ideas about it, um, or you reject the ideas even like so much more. But
Yeah.
I think it's so I don't know, it's really sometimes it's really sad to see the mental frameworks as far as like what like I said before, how it manifests in our own communities.
I think
Yeah.
you guys kind of just tapped onto something that we don't often talk about as well, is the internal stuff, like how we internalize this, how we
Right.
to continue for ourselves. Because, for example, like there's a conversation I had this past break with my mother, and I was trying to explain to her. She was telling me basically like, there's so much like your generation is so soft. You guys have all these diagnoses, depression, this, anxiety, that, da, 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 da. And I was like, I don't think that there's more with our generation. I just think our generation knows how to identify it. And I think
Right.
that's the difference between my generation and your generation. You guys don't know how to identify this because you've been normalizing it for generations and generations and generations. And
Exactly.
I think just to write it off as, oh, your generation is soft, oh, your generation this, that, that's allowing that's allowing the disparities to continue. That's allowing
Mhm.
it to
Right.
It's
continue
enabling, yeah.
generation because you're basically advising us to ignore our pain, to ignore our depression, to ignore our anxiety we have about the world when this world is out to get us. This world is scary. This is not something just to be like, you know, lackadaisy about. We should be like, no, this is affecting me. This
Mhm.
this is not good for me. This is not good for my mental health. And I think they have some type of trauma bond to their trauma
Yeah.
that they don't want to get rid of it. And it's kind of scary because that is how we and they allow it to continue each generation.
Yeah, and they don't really like do things to like necessarily help it. Like, for example, I feel like our generation more like we are more educated on the fact that we can like go to therapy and stuff to help us. But I feel like the older generation, they're so stuck in their head, they might feel like, oh, what do I need therapy for? Like, they think therapy is something that's for, crazy people
Crazy
or
people.
exactly or something like that. When really it's just a solution for mental health problems. Like it's someone to talk to, better yourself. And it doesn't have to, I feel like everybody needs therapy at the end of the day in their own type of ways. Like it doesn't have to be if you're crazy or if you go through something that's just so traumatic or something like that. Like.
And another thing too, I think, which we should talk about, is they always say, okay, even if they do accept, yeah, they probably were depressed. Yeah, they had some issues with their anxiety, but they got through it. They got through it by drinking themselves to death.
Exactly.
They
In
knock
unhealthy
back a bottle
ways.
every
Pay
day.
attention
They
to the
knock
Yeah, they
coping
don't
bottles
get
back
mechanism.
through it in
every
the healthy
day.
ways at all. They get through it in the most
You know,
unhealthy.
so it's like the coping mechanisms weren't the healthiest either. Some, and I
Exactly.
will say, some of them cope through religion. You know, some of them cope through alcoholism. Some of them
Hmm.
cope through drugs. And this is the same things that we're criminalized for.
Right.
So while
Right.
we're showing the rest of
Okay.
the world we are in so much pain, we're criminalized for how we cope with that pain. That's what I add to it. Add another brick, add another brick to the load. Like it's not going to help us in the long run.
Right.
That's true.
I'm trying to think like how many Black elders I know have been to therapy to unpack the racial trauma they've had, and it's not many.
It's
And I
not
just feel
me.
like sometimes I think about my grandparents and like they're in their 80s now or late 70s, and just thinking about how like when they tell me they lived through like Jim Crow and like segregation and whatnot, it's like they speak of it if like it was just like,
No, it happened.
yeah, like, oh,
Like
back in
it's
the
normal.
back in the
That was
day,
scary.
Like what?
we
Like
like
I
we were
just
in
can't
segregated
imagine.
schools. Like, and
I
I'm
just
just
really,
like,
yeah, I just can't imagine. That's really scary.
Yeah, like that's not okay. That's like that. Somebody should go to jail.
and
Like
I just
it
Right.
really is scary.
and
Yeah.
like through their life, like they've probably experienced so much trauma that just doesn't go like talked about. And it's I can only imagine like what that does to the mind when you're kind of like desensitized to your own pain and oppression. And like you were saying, Jay, like this is cyclical. Like we endure this trauma, this pain, and then we don't have the best coping mechanisms. We're not, given the best access to mental health resources, or even have the cultural um norm of like seeking out this help. So then we're also criminalized. And then it just leads to
Mm.
like our suffering is just continuing.
Continuous.
Nonstop.
Yeah.
And then the conversation gets so much deeper if you want to talk about the gender parts of it.
Yeah. It's
Trauma versus
it's
black
a lot to
identity.
unpack.
it's a lot to unpack, but
It really is a
we
lot
might
to
have
unpack.
time to get to that
Mhm.
today.
Unpacking this in therapy.
Mhm.
This was a good conversation though. I really did like this. Um, just to be able to like just have an open discussion about
Mhm.
things like not like just unstructured and just be able to, yeah,
Just talk as we need to.
yeah.
Should we probably talk about our organizations now?
Mhm.
Yeah.
Yes.
So I know one organization that does help with Black mental health is the Black Mental Health Alliance organization. They contribute in the community. It's kind of like, hmm, they contribute to the community. They offer after school programs for children. They have um, informed care from Black therapists. You can donate, you can volunteer, you can become a member as students. We can have internships. They basically raise awareness for Black mental health specifically. They focus on informed care. So, like Morgan was saying, they do culturally competent care. They offer that. And I think that like being aware of these type of resources, being aware of these type of organizations is something that is going to help us. Knowing that these types of things are out there um, will significantly contribute like to how we can build Black mental health, how we can fix it.
The organization that I reached out to that I feel like should be a part of this conversation is Youth Day NOLA. They're a community organization that host Youth Day the last Saturday of each month. And every month they go to a different ward. So they're very intentional with the way they planned out this event. They wanted to have the biggest impact on the city. So every weekend they're traveling to a different neighborhood park. They're in the 7th ward 1 month, the next month they're in the 9th ward and such and such. And what I really feel like is powerful about the event is that people travel to the next community over. So you'll see people from like the last month, they're coming out to the next one. So like communities are intermingling this way. But they are backed by multiple organizations. One notable organization is Positive Minds, Positive Movement, which is a mental health and wellness organization. I feel like Youth Day, they implicitly foster mental wellness through promoting Black joy. Black joy promotes empowerment, solidarity, and challenges systems of oppression, and it empowers individuals and communities to reclaim their narratives. So through this, like fostering of fun and just like music, activities, and food for this amount of time, it gives us a space to reclaim our joy. It gives us an opportunity to fellowship with one another. And I think this is important for our healing and for sustaining, you know, our mental wellness and whatnot. But I feel like through engaging more with Youth Day NOLA, the organization can be even more powerful. The more people who come out, the more people it touches. And I feel like particularly their mental wellness organization, the work they do could be magnified as well.
One thing I forgot to mention, which I'm going to say very quickly, um, the Black Mental Health Alliance organization also uses mental health professionals. So, like for Damaria's case and in Jordan's case, they have professionals that are informing others on how they can better, like, solve the Black mental health crisis. Um, I'm sorry, my voice keeps going out for some reason. I'm not sure why. That's just what I wanted to say. They also have professionals who are advising them on how they should go about this. They have mental health professionals who are hearing what Black communities need. So it's giving us, the listening ear that we really need in a time such as this So I wanted to make sure I added that.
So an organization that I know targets mental health that I know of is Therapy for Black Girls. It's an organization that really is developed to having conversations about mental health um and to allow these conversations to be more accessible to Black people and relevant as well and relatable, just a space to have um these talks and discussions that are really needed in society. They really talk about the stigmas around mental health, and how it's looked at, especially within the Black community, but also how how society kind of handles the mental health of Black people. So I think this is a really good organization to get familiar with. Um, yeah, and as far as not to make this too long, because it says we have 8 minutes left, but um, as far as like a call to action, I would say for one, like I said before, um, holding our physicians um and clinical like therapists and whoever really um holding them accountable to one representing everyone, um including minorities, but also coming from a place of compassion and understanding when they have clients in front of them, and like really being devoted to understanding them instead of kind of overlooking what it is that they are experiencing. Um, and so things like that. I feel like if more people came from or more doctors or whoever came from a place of compassion instead of I don't know how to explain it. But I think if more people came from a place of honestly just love as in understanding, then I think a lot of this would be it wouldn't be as hectic as it is. So yeah.